So we will continue with the last class. In the last class, we discussed about the diabetes mellitus, its definition, what are the risk factors of the diabetes mellitus, the classification of diabetes mellitus, signs and symptoms, and how to diagnose the diabetes mellitus. So in today's class, we will discuss what is its management and how to prevent the diabetes mellitus. So the management. The therapeutic goal for the diabetes management is to achieve the normal blood glucose levels. Obviously, the first and foremost, the goal is to normalize the blood glucose levels, which is also known as euglycemia. But there should be no any hypoglycemia. Hypoglycemia is a disease condition in which the blood glucose level falls below the 60 milligram per deciliter. So the second goal is there should be normalization of the blood glucose level, but without any hypoglycemia and without any seriously disrupting the patient's usual lifestyle and the activity. And the management should not disrupt the patient's usual lifestyle and the activity. So in the management portion, there are three components which are very important. First is lifestyle changes, second is nutrition management, and third is pharmacological treatment, in which medications and the injections are available. So first, lifestyle changes. As you all know, the risk factors for the diabetes mellitus include weight, obese, right? When there is a BMI is more than 23 kg per meter square. So excessive weight is the first risk factor. Second is inactivity, or the person is not involved in the physical activity. Then smoking, if the person do the smoking. So lifestyle changes plays a very important role in the type 2 diabetes mellitus. It will slow the progress of the disease also, and it also prevent the person prevent a person who is pre-diabetic to uh, progress towards the type 2 diabetes mellitus. So exercise is required, weight loss is required, and dietary changes are required. We will discuss about dietary changes in the nutrition management. Then second is self monitoring of glucose. So all those who are having the DM, they must check their blood glucose levels. So the checking of the blood glucose levels depends upon the doctor's order. Many person may check their blood glucose levels once a day, or only the fasting blood sugar levels, or um, before each meal they check their blood glucose level. So that depends upon what is their condition, and it depends upon individual basis, right? The nutrition management. In the nutrition management, diabetic diet is given. So this diabetic diet is especially made for those who are having the DM. So diet should be low in the sugar. Obviously there should be low sugar. Then refined carbohydrates. There should be low refined carbohydrates, but there should be high dietary fiber, especially the soluble fiber. So we will discuss about this dietary management, right? First, eat more. What should the person should eat more? The person should eat healthy fats from nuts, olive oil, fish oil, flax seeds, and the avocados. Then fruits and vegetables should be eaten. Juice should be avoided. Eat the whole fruit. Then high fiber cereals are used, and breads which are made from the whole grains, they should be used. For example, the person should avoid the white bread. The person should take the whole grain bread. Then fish and shellfish, then organic chicken, then high quality protein should be taken, such as eggs, beans, low fat dairy, and unsweetened yogurt. Then what should be eat less? The person should eat less deep fried fruits, packaged and fast foods, especially those who are high in sugar, baked goods, sweets, chips, and desserts. White bread should be avoided, sugary cereals should be avoided, refined pastas and the rice should be avoided. White rice should not be taken. Instead of white rice, brown rice should be taken, right? Then processed meat and red meat should be avoided. Then limit the refined carbohydrate. Limit refined carbohydrate, for example white bread, pasta, rice, or soda, candy, packaged meals, snack foods, these should be avoided. High fiber complex carbohydrates should be used. So basically there are two types of carbohydrates, simple and the complex. The complex carbohydrate break down into simple carbohydrate, so they release the carbs slowly, right? So it takes more time for them to digest into the body, so they will increase the blood glucose level slowly. So that's why high fiber complex carbohydrates should be taken. For example, the white potato should be avoided, sweet potato should be taken, or white rice should be avoided, brown rice should be taken, or white bread should be avoided, whole grain bread should be taken. Then unsaturated fat, fish, which is unsaturated fat. In the fat we should take the unsaturated fat and the omega-3 fatty acids. So it include fish or olive oil, nuts, avocados. Then omega-3 fatty acid sources should be taken like tuna fish or the flax seeds. So this was all about the dietary management. Now what should be taken into mind? You have to educate the person who is having diabetes mellitus to eat at regular set times, because when you eat at a set times or regular times, body is better able to regulate the blood sugar levels and weight also. So eat at regular set times, eat the small meals up to 6 meals per day, then eat roughly the same amount every day, right? Do not overeat once one day or at one meal and then skipping the next. So this should be avoided. This is very important. Now medications. In the medications, these are also called oral hypoglycemic agents. So these should be used. First is sulfonylureas. In this, glipizide, glyburide and glimepiride are as examples. Then bigonides, metformin. This is the first line drug which is used for the diabetes mellitus, metformin. Then alpha glucoside inhibitors, example acarbose. Then thiazolidinones, pioglitazone, example. Then meglitinides, then rapaglinidine. So what is their mechanism, how they decreases the blood glucose level? First we will discuss with the bigonides. Those arrows which are dark, which are thick, they are indicating that this is the major effect of them, right? So for the treatment of diabetes mellitus, bigonides, they decrease the hepatic glucose output, right? In the liver, the glucose is stored in the form of glycogen and it is converted into glucose, so they will decrease this hepatic glucose output. Then th- uh, thiazolidinoids, they will increase the peripheral glucose uptake from the liver, from the muscle cells, from the fat cells, right? Then alpha glucoside inhibitors, they will decrease the glucose absorption from the small intestine. Then sulfonylureas and the meglitinides, they will increase the insulin secretion from the pancreas. So this is the mechanism of all the drugs. The first line drug for the TM is the metformin, which is bigonides. Now insulin are also given for type 1 diabetes mellitus. The only pharmacological treatment is insulin, okay? And also in the pregnancy, oral hypoglycemic agents are not prescribed for the pregnant female. She is put it on the insulin. Now what are the so what are the types of insulin? So we can classify the types of insulin into 5 types, right? Rapid acting insulin, short acting insulin, intermediate acting insulin, and the long acting insulin, and very long acting insulin. So example of rapid acting insulin, first one is Humalog and the Novolog. Its onset is 10 to 15 minutes of its administration. The peak is 1 hour to 40 to 50 minutes. Then the duration is, it will, for the humalog it is 1 hour. For the novolog, the peak means the maximum level of uh, this insulin in the blood, that will be for the 1 hour. Then in the novolog it will be for the 40 to 45 minutes. Then the duration, for how much long it is rapid acting, so it will have a very rapid onset like 10 to 15 minutes, but its duration will be short. It will remain for 3 hours. Humalog will remain for 3 hours. Novolog is remain for 4 to 6 hours. Now indication, it is used for the rapid reduction of glucose levels and to treat the postprandial hyperglycemia and or to prevent the nocturnal hypoglycemia. So rapid acting insulin is used for this. Second is short acting. Short acting example is Humalog R, Novolin and R. The onset, its action starts after half to 1 hour. Its peak action is 2 to 3 hours later. The duration, it will remain active for 4 to 6 hours only. And short acting is usually administered 20 to 30 minutes before a meal. It may be taken alone or in combination with other longer acting insulin. Then intermediate acting. In the intermediate acting, NPH is there. NPH is neutral protamine hagidon, right? And also Novolin L, Novolin N. So this is generally used. The onset for the NPH is 2 to 4 hours. Humulin N, it is 3 to 4 hours. The peak for the NPH is 6 to 12 hours. Similar for the Humulin N. And duration for the NPH is 16 to 20 hours, and for Humulin is also 16 to 20 hours. And it is usually taken after the food. Intermediate acting is taken after the food, not before the food. Then long acting, the example is ultra lente, which is most commonly named as lente injection. Its onset is 6 to 8 hours. Then peak is 12 to 16 hours. The duration 20 to 30 hours. Why it is called long acting? Because it has a longer action, longer duration of action, right? 20 to 30 hours. That's why it is called long acting. It is used primarily to control the fasting glucose levels. And then very long acting, it is Lantus. It is the onset is 1 hour. It has no any peak, and for 24 hours it is active. An indication, it is used for the basal dose. Basically we have two types of insulin in the body. First one is basal insulin and second is bolus insulin. So for the 24 hours a day, some amount of insulin will be released into the circulation so that uh, our blood sugar level maintain normally. But when you ingest a food, at the time the insulin is increased, so that is called bolus insulin. So this very long acting insulin is used for the basal dose. So we can say that all these types of insulins are named because of their uh, duration of action. For example, rapid acting, it only work for 3 to 6 hours, right? Then short acting 4 to 6 hours. Then intermediate, it will work for 16 to 20 hours. Then long acting, it will work for 20 to 30 hours, and very long acting work for whole day. So that's why their names are like this only. Now the insulin, where should the insulin should be administered, right? So insulin is given by the subcutaneous injection route, right? So what are the sites of insulin injection? The upper outer arms, the abdomen, the buttocks and the upper outer thighs. The main important thing is that in the abdomen, okay, at least 2 inches should be, the size should be 2 inches away from the navel. From the navel you have to inject the insulin 2 inches away from navel, right? So And the most important thing here is abdomen is the preferred site for the insulin injection, because here the insulin is absorbed quickly also and it is effective also. So how we can administer the insulin? First, we can use the insulin syringe. Second, we can use the insulin pens. These are pre-filled pens, right? And there are needles also. Then a set then in the pen, how many units, how many insulin units needs to be administered, they are set, and then the pen is used. Then insulin jet injectors. For those who have a fear of needles, we can use insulin jet injectors. There are no any needles used. Then insulin pumps. Insulin pumps uh, are used in those cases where the short acting insulin or rapid acting insulin is administered throughout the day, right? And there is no need of giving the long acting insulin. This is most commonly used for the type 1 diabetes mellitus patients. So I will send you the videos regarding how to use the insulin pen, how to use the insulin jet injectors, and how to use the insulin pumps, so that you can educate the patient about them, right? Now, if you are administering insulin to the patient, what can be the complication? First one is allergic reaction. They can be local or they can be systemic. Local means at that site where you have administered the injection, or systemic means whole your body is allergy. Then third is insulin lipodystrophy. This is very important complications, but it is not so serious, but yes, it occurs very frequently. What do you mean by lipodystrophy? It includes lipoatrophy also and hypertrophy also. So what's happened when you are administering the insulin, it is administered into the subcutaneous tissue, right? So there the lumps of fat can accumulate there, or the fat can be broken down. If there is accumulation of the fat, then it will be called lipohypertrophy. First image, first arrow, red arrow mark showing the lipohypertrophy. Lump occurs there and it is soft, it is firm, right? Then second is lipoatrophy, in which there is retracted skin, and the fat is broken down there. Okay, and sometimes there is discoloration also, bruising also at the site of injection. So this can occur in the insulin injection, those people who are taking the insulin injection. So lipodystrophy occur. Now, how to prevent this lipodystrophy? For that, you have to educate the patient that rotate the insulin injection sites. For example, I already told you 2 inches away from the navel administer the insulin injection. Then you can divide the abdomen into 4 parts. In the first diagram you can see 1, 2, 3 and 4. We have to rotate the site. Firstly, we will administer the injection at the first column, first box only. Okay, in the second diagram, this first column is also divided into four boxes, right? 1, 2, 3 and 4. So at one time I will administer the insulin at one point, then and the next time I will administer the injection at the second point, then I will administer the injection at the third, and so on. In this way, the abdomen is divided into 4 parts, and one part can be utilized for 4 insulin injection. So this is the way we are rotating the insulin injection sites. This is very important, and you should also teach the patients who are using the insulin pens, jet injectors, so that the lipodystrophy can be prevented. Now, what are the complications of diabetes? The complications of diabetes can be classified into microvascular complications and the macrovascular complications. So, because of the increased blood glucose levels, there is a damage to the blood vessels. If the damage to the blood vessels, if there is a damage of the small blood vessels, small, okay, micro means small. So if there is a damage of the small blood vessels, it will be called microvascular. And if the large blood vessels are destroyed, right, are damaged, then it will be called macrovascular. So in the microvascular we have retinopathy, nephropathy and the neuropathy. So retinopathy, the eye. In the eye, high blood glucose level and high blood pressure, okay, can damage the blood vessels of the retina. So the person will be having retinopathy and blindness may occur. The person also may have cataract and the glaucoma. Now in the kidney, in the nephropathy, high blood pressure damages the small blood vessels and excess blood glucose overwork the kidney, and this result in the nephropathy. So the person may have chronic kidney disease. Then neuropathy, hyperglycemia damages the nerves also. They also destroy the nerves in the peripheral nervous system. So the person feel the pain and the tingling sensation and the numbness. Also, if there is a wound, it will get undetected and the person maybe get infected, and there is a slow healing of the wounds, and slowly it will lead to the gangrene. Gangrene, it is a condition in which there is no oxygen supply to that part, leading to the overall damage or death of the tissues. So in the microvascular there is retinopathy, nephropathy and the neuropathy. And in the macrovascular, for example, there is increased risk of stroke, increased risk of coronary artery disease and the peripheral vascular disease. So there is an increased risk of stroke, cerebrovascular diseases, including the transient ischemic attack and the cognitive impairment. In the heart, hypertension and insulin resistance will increase the risk of coronary artery diseases. So what's happening? Because of increased blood glucose levels, the blood vessels are damaged. Also there is accumulation of fat in the arteries, so the person has high chances of getting the coronary artery disease. Then in the peripheral vascular diseases, why it will occur? Because there is a narrowing of the blood vessels, so the blood flow will be decreased, and if there is any wounds, that will take more time to heal. So all these are the major complications of the diabetes. Now one of the most important complication is diabetic foot, in which the person is having the diabetes mellitus also and ulcer also in the legs, right? So how to prevent this diabetic foot? Avoid extreme temperature, okay? Protect the legs from the hot and the cold temperature. Do not put the feet into the hot water. Always test the water before putting feet into it. Never use hot water bottles, heating pads or electric blankets. Avoid crossing the legs so that blood flow can't be reduced. Avoid smoking, because smoking is responsible for is responsible or is a risk factor for progression of the diabetes mellitus. Then seek the assistance of a podiatrist or the foot care specialist if there are corns, calluses or ingrown nails or other foot care related issues. Then control diabetes by maintaining the normal levels of blood glucose. Now that was the prevention. Now what to do if there is a diabetic foot? So check the feet daily. Look for any redness, swelling, blister, cuts, soreness also. And if the person is unable to see the bottom of that foot, use the mirror or ask someone else to help them to see. Then wash feet daily. This is very important. Dry them also, especially between the toes. There should be no any water left in between the toes. There will be, if there is a moisture, then it will cause the infection, right? Then walk frequently and be more active. Trim the nails straight across without cutting them too short, and then with the use of nail file, file the edges, make them smooth. Then when using lotions to the feet, always apply a thin coat and avoid the area between the toes. Then visit a foot care specialist or the podiatrist once or twice a year for a thorough exam. Never walk barefoot. Wear comfortable and properly fitting shoes that fit well and protect the feet. Check inside of shoes before wearing them. Make sure the lining is smooth and there are no objects inside. So this is the way you have to educate the person with the diabetes mellitus that take care of your feet. So all these are very important points and these are essential for educating the client. Now, what is the prevention of the type 2 diabetes mellitus and its complication? First, achieve and maintain a healthy body weight. That is very important. Then, ask the person to remain physically active. Do at least 30 minutes of regular, moderate intensity activity on most days, and more activities required for the weight control. Then, eat a healthy diet that should be rich in whole grains, fiber. Choose the unsaturated fats and the omega fatty acids such as polyunsaturated fats like nuts, vegetable oils, fish. Then limit the sugary beverages. Eat the less red meat and other sources of saturated fat. Then avoid tobacco use. Smoking increases the risk of diabetes also and the cardiovascular diseases also. So this was all about the management, in which we discussed what are the lifestyle changes that are required for a person who is diagnosed with the diabetes mellitus, especially for the type 2 diabetes mellitus. Then we discussed about the nutrition management of a person, the medications which are required, the insulin therapy for the person, and one of the and the complications of the DM, and what is diabetic foot and how to take care or how to prevent diabetic foot and how to take care of diabetic foot. So in the next class we will discuss about the diabetic emergencies, what are the diabetic emergencies and what is the nursing management of a patient with diabetes mellitus. Thank you.